Hello, and welcome to our podcast series, Defining Health Equity from the Voices of the People Doing the Work. Yes, we know that there are hundreds, if not thousands, of podcasts talking about health equity. So let's talk about what's going to be different about this podcast. First, let's define what health equity really means. This definition is from the CDC. You may have heard of the CDC, the Centers for Disease Control and Prevention, from COVID days. And here's what they say. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. Achieving this requires focused and ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and healthcare, and eliminate preventable health disparities. Wow, that's a mouthful. So let's use an example of something easier to understand for the non-healthcare professionals that may be listening into this podcast. Let's say a concert is coming to town from a group you love. In fact, everybody loves this group. The concert is open to everyone, and it's being held in an outdoor arena in a big flat field. But of course, the taller people, they get a chance to see this band clearly. But the shorter folks can't see anything over the heads of these tall folks. You may have had this experience. But what if we held that same concert in a stadium with graduated seating? That is, we can offer the shorter folks an opportunity to sit in the higher seats, and the taller folks can go right up front. This way, everyone gets a chance to see the band and hear the band, irrespective of their height, which is basically out of their control. So that's what we're going to do with this podcast series. We're going to use terms, examples like that, and stories to explain this huge, and very complicated problem in our country we call health equity, or more appropriately, health inequity. To give you an idea of what we're talking about when we say the problem of healthcare equity or inequity, we mean the U.S. spends $4.1 trillion, $4.1 trillion on healthcare in this country, or approximately $12,500 per person per year, approximately 20% of our entire economy. So in other words, $1 is spent out of every $5 for the total economy on healthcare alone. This is about twice as much as countries of comparable size spend on healthcare in their countries. Do we have a healthcare system twice as good as any other healthcare system in the world? And of course, this got worse during COVID as we spent more in healthcare and our economy shrunk a little bit during that time period. So here's our point. In order to solve or even improve this huge problem for all of us, we need to get everyone involved, not just the healthcare people doing the great work trying to fix this huge problem. We can't just depend on the government or our outstanding and very qualified healthcare experts to fix this problem. It's just too big of a problem to put on these very few but qualified shoulders. But to get everyone involved, we first need to educate and explain the problem for everybody so everybody understands what's at risk here, not just the healthcare experts. We're going to do this in this podcast series, and we're going to do it with the folks closest to the problem. We're going to get as close to the front lines as possible and talk to those folks actually delivering care so everyone can see and hear this concert.